everybody, welcome back to my channel. In today's video, we'll be talking about osteochondritis dissecans in the knee. Today I have a very special guest joining me. Thank you for coming.
Thank you for having me.
And we'll be answering all of your guys' questions that you guys have left us in the comments and that have come upon us. With that, let's get right in. Any questions for me to start it off?
Yeah, we have quite a few. So, first up, what is the main challenge you've encountered with OCD in the knee?
That's a great question. I've encountered a few challenges other than pain. Very much is also mentally um, harming, and it's important to stay focused and stay patient with your body when you are going through such things that take such a long time to heal. And knowing that you can't jump or run or do any of the things that you might normally do, and know that your body, everybody is going through a different journey, and your journey is just like this, and that you have to stay patient and you have to not fall into that downward spiral by saying, poor me, oh me. None of that. You have to stay up, stay positive, and I think that's how you stay in a great mood.
Yeah, so how are you holding up mentally?
Mentally, I think I've been doing really well. I've been spending time with my sister, my mom, my dad, my dog, even because I haven't gone out of the house too much because it's kind of hard to travel other than school once in a while. And so I've been holding up pretty well. Staying positive has really helped me. Watching TV, reading books, doing drawing, that's all great. And I highly recommend find something you love while you have the time, so much of time, and just find something you love and really pursue it and have fun.
Great advice. So, on a different note, have you noticed the pain going down at all?
Ah, yes, now we're in the physical aspects of these. So I'm not going to show you today's um, diagram of the knee or even my knee because my knee is looking a little uncovered right now. And so recently my swelling has gone down significantly, and I have been very confident that I'm able to bend it more using my fellow strategy, the bending game.
So, you mentioned the bending game. Can you please further explain that to me?
Ah, yes, glad you asked. So the bending game is my version, and me and my physical therapist, we just come up with it, and it's basically our excuse and our name for how we're gonna increase our full range of motion, trying to make it more fun, which is a great strategy. Find something that's not so fun and make it more fun. And so the bending game is how we're trying to push ourselves through the pain, even though usually when we see pain, then we know that we should stop. We should tell adults, which is always the right thing to do, even when you're told that you should be bending and pushing through the pain. Just make sure that people are aware of what you're going through. And so, right now, we're going through the phase where we're trying to get full range of motion in our knee, and so we're trying to bring back that full range of motion. 115 approximately is how much your knee on normal should bend. And so then right now I have about 86 degrees of bending in the knee, which is pretty good. Any other questions for me?
Have you ever experienced unbearable pain during this recovery process?
Oh, this is where things start to get interesting. So you would expect on the first day that you would have the most pain, but that's actually not even true. Uh, I think a common misconception that we all think of when we think of all of this pain that is going through surgery is that it's mostly the 7 days um, after surgery, post op, are the most painful, and then after that, it just dials down. And in some cases, that is true. But when you're doing OCD drilling, then it's really not the case. And uh, really, what it is that uh, it's very consistent. It has spikes and little ups and downs, but it stays, and it's kind of a very steady decline. But it takes some time, and the unbearable pain so far has not been there. I I've had once or twice, maybe, when I have tried bending my leg, it's unlocked and it's really jolted because when we're doing that, you're trying without the brace, and so it'll jolt back, and it really affects how you feel. It hurts like way, way a lot. And so that's something you gotta be careful with, okay? You don't wanna do that ever again. And it really ruins how you feel. And so just try to stay away from all of that. Make sure you're guarding your leg that you're bending so that it doesn't unlock suddenly. And then also make sure for the first 5 days, I would say, keep on top of pain meds. Because I remember one night I woke up and it was really bad. I said no opioids because I don't want to take any opioids, but it was horrible pain, and I woke up and I couldn't sleep, and so it was because we hadn't taken the pain meds in 5 or 6 hours, and so it started to hurt, and since it was so early, it was hurting a lot more. And any other questions with that?
On a kind of different note, earlier did I hear you say that after you get the OCD drilling surgery, you should aim to achieve full range of motion early on for a faster recovery?
Ah, yeah, that is true, and it's a very common misconception again that you don't want to move it at all, and that you're trying to put as less weight as possible, just lying down with your legs completely straight and um, constricted and very tightened up so that it doesn't get any weight on it. And that's actually not true. What the goal is for now is to be able to not put weight on it, but actually be able to move it and activate your muscles so that they don't become tense. Think about it as like um, a rubber band. Your muscles are like that rubber band. When you stretch it, then it becomes more pliable as the more you do it. And think about that break of the rubber band as when your muscles are fully stretched. If we let it sit, that rubber band, then your muscles will get so tense that they just kind of shrivel up. And then you need more interference, surgical. And so that's a great question. Full range of motion is very important. And I think that you need to get it early on so that it doesn't affect you later in the stages. So it's really important to do it early on, as soon as you go to first physical therapy. With that, are we finished yet, or anything more?
That's all I have.
Okay, thank you for coming, and I hope to see you guys in the next video. If you have any questions, please link them down in the comments. And before I come off, then I would like to thank the ROCK organization of Osteochondritis dissecans. They have a great team of doctors working on not only my knee, but millions of other people across the world. And they have a great organization, and I highly recommend you check it out at meocd.org. Thank you for watching, and I hope you enjoyed.